Can you make it bigger? Welcome to Yugen Hour, a new TV program brought to you by Yugen Care by Dr. Jihad. The aim of the program is to break down the barriers that are associated with many health taboo topics. The season opening episode is around erectile dysfunction, the causes, both the physiological and the psychological, as well as the cures, including the cutting-edge treatment, the PEOT. Erectile dysfunction, also known as ED, can lead to depression, anxiety, and suicide. Interestingly, over 50% of men over the age of 50 at some time in their life will experience ED. And surprisingly, 25% of men under the age of 40 will also experience ED. In fact, ED can strike any man at any time. My name is Selina Ellicott and I am your host of Yugen Hour. My aim today is to open up this sensitive topic related to sex and to hopefully break down some of the barriers that men and women find it so difficult to discuss. In this programme, I will speak to 4 guests who each have a different perspective on ED and how it's related to sex and relationships. My first guest is Dr. Charles Runels, online from Alabama in the US, and is the inventor of the P-shot, the O-shot, the vampire facelift, and vampire breast lift. My second guest, Adel Hussein, is a men's masculinity coach who feels that the taboo topics like ED can severely affect a man's identity.
My name is Adel, and I'm a masculinity and mindset coach here in the UAE. Now, whilst I work with both men and women, most of my clients are men. I tackle subjects such as confidence, mindset, mental health, physical health, sexual health, and relationships. So this is something that you're interested in or you are struggling with in any of these areas, please do not hesitate to reach out to me.
My third guest, Mila Mori, an ICF life coach, proposes that men should pay more attention to the emotional connection than the physical one.
Hi, my name is Mila. I'm a counselor and an ICF coach. I help with victim mentality, with trauma and self-expression. I help my clients strip years of trauma in order to be able to self-express and live a fulfilling life.
And my final guest, Dr. Ella, a urologist and sexologist here at Yugen Care, who treats patients with ED using the PEOT.
Hi, I am Dr. Ala Al-Qutaini, a specialist urologist from Yugen Care by Dr. Jihad. My field of experience includes but not limited to andrology, sexual dysfunction, and I have a special interest in regenerative treatments and longevity.
Hi, Dr. Charles. Thank you so much for calling so late from Alabama in the US. It's so nice to have you here. First of all, Dr. Charles, can you just explain to us what is the PEOT?
The PEOT is a way of taking a person's own natural healing factors that are in the blood already. It's the thing that the body uses every time you're injured or have surgery. It's the growth factors that are in the platelets. And then using simple technology at the bedside, taking the blood from a person, from a man, and then putting it back into the penis to make the tissue healthier.
Can you explain to us then, I hear it's a really interesting story as to how you came up with the idea of the PEOT.
Yeah, sure. I'm happy to share it. I was involved, have been for a couple of decades in tissue repair, and as a general internist, I had been involved very intensively in helping both men and women improve their sexual function and their relationships. And so when platelet-rich plasma was introduced as a cosmetic procedure, and I was already running a wound care center, it seemed apparent to me that wow, if this would work to improve the tissue and the blood flow in the face and in wounds, it should be tried in the genitalia. So actually the first time I did it was on myself and seemed to work. And so then I started offering it to patients, and then eventually some research came out of it, and here we are.
Wow. So were you happy to trial this on yourself? Obviously, you were quite confident in that it was going to work.
I was hopeful, and I thought it seemed to me that it didn't. And I did this only after I had used it in faces and in wounds and other areas. Actually, the dentists and the orthopedic surgeons were first to use platelet-rich plasma because they have the disadvantage of working with tissue with not much blood flow. So you do surgery on a knee. Well, the tissue in the knee has no blood. Some of the cartilage it's actually nourished by the synovial fluid. So the the orthopedic surgeon said, well, let's just take what would be in the blood if we had blood there and squirt it in the knee. And um, so after using it in the face, taking their technology and using it in the face, yeah, I just thought, okay, well, somebody's got to be first, and if it's my idea, it has to be me. So that's
Okay.
what I did.
Obviously, I'm not jumping to conclusions here, but for someone that may not suffer with erectile dysfunction, the PEOT then obviously can be used to not only solve the ED problem, the erectile dysfunction problem, but also to enhance a man's performance in the bedroom. Am I correct in thinking that?
That's exactly right. As a matter of fact, it reminds me of an incident where I was introduced through another doctor to the leader of a country, and he seemed a little bit bashful that I was there, and I said, it's okay. Even Lamborghinis need a tune-up, and and if you think about it, if you go all the way back historically, there's an analogy with weight training. If you go back to the 50s and 60s, 1950s and 1960s, it's hard to imagine now, but athletes were discouraged from lifting weights because it was thought to make people muscle bound and uncoordinated, but strength training was used for people who'd suffered stroke to help them recover. Um, the idea being the same thing that helps you from way down to get up here can help you from up here to get way up here. And that same principle applies to many other areas of medicine. So it can help a man who has problems to become functional again. But of course, it can help someone who's functional to become healthier and prevent dysfunction. I think the time will come when men and women have platelet-rich plasma injected into the other parts of the body and including the genitalia to help prevent problems. Already we have some of our gynecologists in our group injecting around the birth canal to help women prevent some of the dyspareunia and the pain and the incontinence that comes after delivering a child. And I think the time will come when men will, instead of waiting until you have a stroke to lift weights, you do it as a young man to keep from having the stroke. And I think the time will come that men will have do similar things with regenerative therapies to help restore the tissue as they go along instead of waiting until they're broken. Everything from, as your guests will explain, what they do to help encourage a healthier body before it's broken. That same idea can be used with some of the technology.
Well, that actually is the same thought process that Adel here in the clinic. He is actually a PEOT patient. So Adel, over to you. Can you explain why you went ahead with the PEOT?
So I have actually experienced ED previously,
Okay.
which was definitely something which I experienced from an emotional performance anxiety related situation. But more recently, like as things are kind of fine, I thought actually I want to experience how this could elevate my sex life and make me feel more, I guess, more powerful, just stronger. And I felt like I had nothing to lose and everything to try.
Okay.
So from my perspective, it was really an enhancement of what I was feeling. And where I've tried things like Viagra and Cialis before, which is as a pill that kind of masks what's going on rather than dealing with the root of a problem. This felt like something which would deal with a root cause. Was again something which was seen as something completely safe. I was really told that it was safe. It's using my own parts, my own body to heal my body. So I thought, why not?
Oh, wow. So the overall procedure for you was a positive experience?
Positive experience. It was very, very quick. It was seamless. It was moderately, I would say, pretty painless. As you can imagine, there might be a little bit of discomfort, but actually it was fine. It was something which I was pleasantly surprised.
And the effects since?
I can honestly say that it feels like a new part of my body.
Wow.
I definitely feel stronger. It feels fuller. And no complaints at all. Like, it really feels like there's actually just fresh new blood just running through me.
And Dr. Charles, is this generally the feedback that you receive from many of your patients? You know, perhaps those that aren't suffering with ED, you know, if they're having this treatment more for the performance in the bedroom, is that generally what patients say, that it improves their performance and it feels like a new body part?
Yes. Well, if you think about what we had before we had the PEOT, we had things like Viagra and Cialis and surgeries for an implant, but none of those things actually made the tissue of the penis healthier. And so having something that actually improves the health of it, it doesn't work in everyone. You know, just like with any other procedure, there are other parts of the system, thinking systems analysis. You have to get blood to the penis. So if someone has vascular disease higher up in the iliacs that feed the blood flow to the genitalia, for example, they might need surgery for that. But you have a nice, young virile man like sitting there, his body. In other words, if you see someone that if they were injured, if he broke a bone or if he had a cut, his body would heal himself. Well, that's the same person that if you put platelet-rich plasma, their body's going to have a very robust response to those healing factors, and a young person can have dramatic results. And the other deceiving thing is that both men and women, there's this perception that it takes someone with gray hair before there's a problem. And let's flip to the woman's side for a moment. It's been, research has shown that distance runners, even women in their teens, trampoline people, gymnasts, have a very high incidence of urinary incontinence. And men and people who ride bicycles, they risk damage to those nerves. All sorts of sports and activities that we do with youth can have the healthiest body, but then still have problems that need repair. I think there's the misconception that just because someone's young, perhaps something can't go wrong, but just the idea of living brings us your emotional response, but actually other trauma to the body that can cause a problem, even in the healthy body.
So in terms of age then, is there like an ideal age to have this PEOT? You know, is it more effective in a man in his mid-30s, say, compared to a man in his 70s? Is it age related?
I think it is more, so there's a couple of main reasons that it's used for both for erectile dysfunction and for Peyronie's, where there's an erection that's not straight, and that's often in young men as well.
Okay.
So, but for all the uses of it, or for the person who's performing well and they just want to maintain or see some improvement, for all those uses, there is a variability in the body's ability to heal itself that changes both with age and the health of the person. So you can have a 70-year-old person, and then with proper coaching, like your other guests can provide, that you create a healthier, younger state of nutrition and mental health. And then the PEOT becomes part of an overall improvement of the system, making it work better instead of just a magic shot that you're expecting to do all of the work for you. So it's a long answer, but the point I'm making is the health does matter at whatever age, in improving the whole system of sexual response and performance.
So if the genuine physiological, if there's a genuine physiological issue in one of your patients, but at the same time, maybe a mental health issue, the patient could be dealing with stress and anxiety, what would your recommended kind of course of action be for someone that's suffering with stress and anxiety, but also may have this physiological issue?
Right. And I think everybody does. And you try to find me a person who's never had any stress or anxiety related to their sexuality, then I don't think that person exists. And so it's part of that systems analysis. And I would encourage people to do what you guys offer there at the clinic, that it's marvelous to have everything under one roof where you can think about um, both the psychological, the physiological, the medical part of it, as well as some of the surgical things that can need correction. And some do require correction, as I mentioned, that there is no other way to treat, say, for example, a profound obstruction of the blood flow coming from the aorta. We're putting the shot in the penis. So there really needs to be an overall response, but everybody at some point in their life is going to have some sort of psychological, and even when you make it better, it can make it worse. So if you make, for example, if you improve the woman's functionality, now the man has trouble keeping up, or you improve the man's functionality and she has trouble keeping up. So it's a miracle that anyone's relationship ever works. But the fact that you could just be put on autopilot and not need to go to experts to see how you might tweak things here and there. I mean, that's what we all need, I think, is an overall approach to our health in general and in sex.
And that's the overall aim of the clinic, is this whole 360 kind of approach to dealing with health and well-being. You know, from the inside out, we look at the whole picture rather than just focusing on, you know, the individual, you know, whether it is a physiological or a mental health problem. I'm just intrigued, Dr. Charles. Surely, you know, if a man is suffering with ED, surely a quick fix is more important. You know, something like Viagra. Why would a man that is suffering with this choose to take the PEOT over something? You know, you're in the heat of the moment. You know, I'll just take a quick pill and I'll fix it. Why would they choose the PEOT over Viagra?
Well, they may choose both at some point, but the reason you would eventually choose you may choose. It's like as an ER physician, I used to teach the paramedics, and there are some drugs that are known to help you if I'm doing CPR on you, and then there's some that are experimental, or not experimental, but not as well proven. But if you're getting CPR, you want everything. And if you have a relationship that's metaphorically having CPR, your relationship's strained, your marriage is strained, and it's affecting your whole life, then you use everything. But eventually what you want is a healthier body and a healthier genitalia and a healthier psychology. So you may use the Viagra in the beginning, but if that's your only choice, eventually the pathology catches up and the Viagra quits working. And then there's also side effects. Long term, we now know that people who stay on Viagra for a long time do have a risk of it affecting their eyesight. There's some who don't tolerate it. As I mentioned, there's nothing about that treatment that's actually making your penis healthier.
And there's also, I suppose, the psychological aspect there. You know, if a man is completely dependent upon Viagra, then surely that's going to play with his mind. You know, if he's the only way that he can have an erection is by taking a pill, then surely, you know, longer term psychological effects that may have. So the PEOT is a much longer cure.
It's getting to the true etiology of the problem and correcting it. That is for sure, so that you have less need for other treatments.
Obviously, for a man, I know my husband is really scared of needles. The thought of having a needle injected into a penis surely would be a barrier for many men. I don't know, Adel, how did you feel when the doctor came at you with the needle?
And I didn't really think about it too much at the beginning. In hindsight, I think, why didn't I think about it so much? But it was very small. It was a small needle. It is quite daunting to think about it. But again, knowing that this has been done many, many times. I wasn't like patient number one. It's got a lot of experience in it being completed and carried out, and having like I think 100% success rate, and whatever actually the figure is. It didn't daunt me like that.
Okay.
Yeah.
Are many men put off Dr. Charles, by this, it's quite an invasive procedure, a doctor coming at you with a needle?
Well, you think of the first time I did it, I'm looking down at what I'm doing and I'm thinking, there's just something not right about this. And I was trying to imagine if something went wrong, how I was going to explain it to my colleagues if I had to go to the ER or something.
And your partner.
The really, if you get to thinking of it, it's really all tissue. You have blood and you have muscle and you have collagen. But the reason, of course, and so a shot is a shot, and none of us like to have a needle. But the idea of it is much worse, as you heard, than the actual. It's an injection, and but of course it's sacred to us because it's how we create our relationships.
Okay.
Our face and our genitalia, they're so sacred. You know, if I throw a baseball at someone, you're going to cover your face and your genitals because that's how you relate to the people you love. So the idea of sticking a needle into either of those places psychologically doesn't feel right to us. But as you heard, it's just a needle like we use to give a shot any other place, and we have ways of making the pain either zero or close to zero.
Okay. How quickly then, once the procedure is finished, how quickly can a man perform? Like, is it immediate results? Are they able to go home and jump into bed with their partner, or are there side effects?
Without telling too much detail, I'll tell you that I recommend.
Oh, please share the details.
It's one of the few procedures I do for people, so where the aftercare instructions are to go home and enjoy sex with your wife. There's no downtime at all. I actually taught a class in San Diego, California, and the man model who came in agreed to be a model under one condition. He brought his wife, who was a model for our O-shot procedure, for the doctors I was instructing. And then we treated him, and we had an understanding that after I treated them both, he asked me to leave them alone. And so I didn't tell the other physicians. I just left them alone in the exam room with their little 6-month-old baby in a bassinet thing.
Oh.
And I went back into the lecture hall, and they came out, 30 minutes later smiling. So I don't know if that answers your question or not, but I encourage this extra blood flow, and things do seem to function well immediately afterwards. The only wait time is to clean off the numbing cream that's often used to prevent.
Okay, so it's all part of the aftercare then.
Mm-hmm.
Perfect. Okay, you mentioned then success rate of the treatment. How do you measure the success rate of this treatment? And I've also read that the PEOT, if it's done alongside the shockwave therapy, then it's much more successful. I know Adel here, he had the PEOT alongside the shockwave therapy, but how successful are those combined? Or is it okay to just have the PEOT?
Yeah, I think this is where your physician and I know you guys have amazing people there that are experts, worldwide experts, but there's a need for that sort of thoughtfulness about when to do which and how much of each, not because there's any great danger, but just to maximize the effectiveness. But what success looks like depends on the person.
Okay.
So as an example, you just heard about one success in a young man who's virile, and then another story as a comparison. I had a man come to me. We live close to a military base here, and he was retired military, and been married to his wife for 60 something years. They were going to do a second honeymoon where they traveled across the U.S. in a camping that they had done when they were on when they got married.
Mm-hmm.
And he had prostate surgery and unable to have an erection, even with Cialis. So I gave him a PEOT, and 6 weeks later or so, he went on their honeymoon, and he came back and he said they had more time, they had more fun than ever. But his idea of the success was he was now able to have sex again on the Cialis, which had quit working. It wasn't balancing the couch on erection like your virile guest there. He was able to have enough tumescence that he was able to have intimate relations with this woman he had loved for 60 plus years. And the Cialis had quit working and now it worked. So that was his measure of success, not an 18-year-old erection, but enough to have intimacy with this woman that he adored.
Okay, that's a lovely story.
So if you want a number, though, I would say that in the young person, it's upwards of 80, 90% that they'll see an improvement. If you look at it across the board, there's a measure of erection. There's an erection scale, and across the board, it bumps people up 7 to 8 points on that erection scale. And it's a scale of from 5 to 25. So practically speaking, what that means is if they're on Viagra at a high dose, it'll start to work at a lower dose. If they're on a low dose, they may come off of it. If they don't need Viagra, they may find their erections are firmer and last longer. So those are the sorts of things that you see.
Okay, all right, that's good to hear.
I'll reemphasize that there's such a need for all the rest of it. For example, the aerobic exercise alone, which is why I love that you guys have this philosophy and determination to not just think about the symptoms, but getting down to the metabolic reasons and the psychological reasons for the problems and fixing it from the inside out, as you say, not just inside the body, but inside the cell, inside the metabolism. As another example of that, aerobic exercise alone will boost people, if it's done consistently, somewhere around 6 to 7 on that erection scale. So if you throw that in along with the PEOT, now you have a really dramatic change in what you see. Sex as an aerobic type activity is about the equivalent of walking upstairs. So, and when you're thinking about how good a man might, or how much sort of endurance a man might have in bed, he should think to himself, what's it like if I walk up the stairs? That's about how long I'm good for active sex in the bedroom. Just as an example of why everything matters when you're thinking about sexual function.
Okay, I'm going to open this up now to talk more about the bigger picture in terms of relationships and in terms of sex and love, and the foundation of love and a successful relationship. So Mila and Adel here have obviously got lots to say on this. So
yeah, I've been wondering about
obviously
Mila.
you do
She's
as well, Dr.
looking
Charles.
smart, and I can't tell what she's thinking.
So what is the foundation of a successful relationship? How important is the sex that Dr. Charles has just explained versus this emotional connection that you have with a partner?
I think for men, sex is incredibly important. I think it's tied so significantly to how they feel as a man. Their masculinity, being able to get it up is almost this sense of, it's like their birthright. It's what they're here to do, to procreate, but not just to procreate. Now it's to have fun, to be able to pleasure the person that they're with. And so if they're not able to do that, then almost like, who are they?
So it kind of identifies them as to who they are.
Definitely.
But is that the same for a woman?
Actually, I don't believe so. I think the emotional connection is way more important than the sexual. The thing is, I believe that a lot of men, they have to deal with this whole concept of toxic masculinity, and so they have to perform, they have to be great. And so when that happens, there's so much pressure. I feel like they can't sort of emotionally connect any longer, and so the sex becomes the
drive out.
Yes. So the sex becomes the outlet for emotional connection. And so I believe like for men, sex is so important to connect emotionally, while for women, it's more of the verbal, right? And so I think we have to consider the fact that women also don't have, a lot of women cannot have orgasms, right? And so I have a story to tell as well of my client who, when she dealt with her partner, when he couldn't, when he had ED, she took it upon herself. So she took it quite personally. And so she felt like it was her sort of wrong.
Her failing.
Exactly, yeah. Yes. And it affects women so much where they take it so personal, and that sometimes women, they start blaming the man, which then leads the man to not perform at all. And so I think if we learn to build that emotional connection, which is based on, trust, respect, then maybe this wouldn't be a problem.
See, my experience in the past was that I had someone who I suffered this performance anxiety with. I explained to her what was happening, and she threw it back in my face. She used it, brought up an argument, which made everything worse. And then that's why I started taking the pills, and then wouldn't even tell her, because that felt like a solution. That meant I didn't have to worry about it, didn't have to think about not being able to perform, and knowing that I couldn't actually bring the conversation to her.
But did you have that emotional connection between the two of you?
So there was a connection, of course, but then when it comes to things like this, you'd expect that you'd be able to have that conversation. I think a lot of men don't want to talk about it because they don't want to face that. Because the second you hear something which goes against, even to having that emotional connection or being honest and vulnerable in a situation, then having it used against you, it's pretty much game over from that.
It's like a vicious cycle then, yeah? If they've used it against you, then you feel your self-worth, you've lost your identity, you've lost your manliness, which then has an effect on how you perform.
Yeah. And doctor, I just want to ask you, do you ever find that you have men that have this problem with erectile dysfunction only within their relationship, but if, say, for example, they go and cheat, for example, maybe you've heard this kind of thing, is it a place where they actually can perform with someone else, but not with their partners?
Yes, of course. There's to me, I think everything that's being said is correct. I think it's a miracle that just a love relationship in general, when you consider a man will feel impotent. Just to take one example, a man will feel impotent with a testosterone level less than 250, and a woman will have a raging sex drive with a testosterone level of 100. So we're just, as one example, we're so metabolically different. It's a wonder we can even have a conversation. And but I do think there's this need, there's this part of all of us that's part feminine that needs to be touched, and part of us that needs to have the sexual gratification. In the end, we all just want to be loved. Emerson called sex and beauty the scaffolding of love, which I think is a nice way to think about it, because as youthful people, it's almost needed to start the relationship. But then as you get older, and like my parents have been married 64 years, and so I'm sure their structure at this point is so strong that it would take it's a whole different ball game than when they first met at 19 and 21 years old. So I think I like to think of it as a scaffolding, and yes, I see that where there's both sides, where a woman feels pressured or a man feels pressured, and then there's negative cycle. The other thing that happens that's different from in a man than a woman is a woman. It's been shown her sexual relationship or her sexual response is based largely on what happened the last time she was sexually active. So if she had a positive response, it becomes more easy for her to respond the next time she's with her husband. She has a negative response, it becomes less easy. And then there can become either this positive, uplifting feedback loop or a negative downgoing. And it's not as much in the man. We're more what's happening in the moment. But the same thing happens where if there's this ongoing emotional disconnect and a feeling from the man that he's being put down, he may go somewhere else where he feels more powerful and have a different sexual response in that situation.
But surely if you've got a strong relationship between two people, and the man in the relationship is suffering with ED, if the foundations of that relationship are strong and that relationship is built on love and trust, surely it shouldn't have an impact on their relationship at all.
Well, it's like, if you think about the mechanics of, just say, your automobile, you can drive it if something's broken, but you maybe have to shift the gears a little differently. You have to think a little bit differently about how you're going to get down the road. And so there becomes the need for modifications as people age. Think with a woman, she's going to respond differently sexually when she's when she's on birth control pills or not, if she's pregnant or not, or breastfeeding or not, and with the man, whether he's having pressure at work or not, or what's going on in his life. So we're all like these, we're all different to start with, and then we're all changing from day to day. So it's truly an art. Lovemaking truly is an art. And when you think you have your lover figured out, they change.
Okay. Yeah.
Physically, emotionally, things change. So if you're committed, yeah, you stay with it, and then you go to a place like you guys have, so that someone makes it so there's less broken physical things, less broken psychological things to work with, but there's always going to be a changing milieu.
But if the ability then for for a man to have sex is fundamental to his identity and his manliness, what can the mental impact of ED be on him?
So I speak for myself, but also a lot of the clients that I work with. So I'm a life coach and masculinity coach. So a lot of the guys that come to me for all kinds of things around confidence and even being more confident with women, or even things at home, and it could be a range of things. But when they're suffering with especially something like this, or their sexuality, or not being able to perform in the bedroom, it affects every area of their life.
Including the woman.
Including the woman.
Yeah.
It affects everything. Because it is so significantly tied to their masculinity, it can often make them just feel like a bit worthless, that they're not enough, they're not good enough, and it's very hard to then come out of that spiral, especially because it's something that isn't talked about, it's not discussed, even among peers, among their friends. So you just go into this shame spiral, you know, and the fact that you feel like you're going through it alone is also even more detrimental to their mental health. I actually spoke about my situation to my men's group, and it was amazing to hear how many men have actually experienced it, but only in private. So even in that circle, they only came to me separately and said, you know what, I've been through the same thing. I've also taken Viagra. Thank you for sharing your story. But they still didn't feel comfortable to express it even after I talked about it in the group, because it's that taboo.
Yeah, the taboo subject, and also the fact that a man finds it harder to communicate than a woman, especially about a subject that is going to impact on.
I don't think they find it harder to communicate. I think that there's so many experiences where when a man does communicate, that he's shot down immediately.
Yeah.
So I think it's more to do with the fear of expressing his truth and what the immediate consequence might be. So I think it's about not feeling safe enough to express themselves.
Yeah, I guess the main factor for that is because a woman will always look for a man who can provide, who can be best at everything, who you can have children with, and healthy children with. And so I guess that's kind of like a subconscious thing for a woman that, I want a man to perform and, everything so well, and including sex. And so I guess a lot of women sort of cannot communicate it well, and a lot of women get shocked by that it happens even. And I can understand sort of women from that point of view, because some women, they care about their sexual contact and they want to have pleasure and they want to experience it. And so but I guess women have to become a lot more understanding of these things. I personally had no idea that even erectile dysfunction existed till I was like 26. I had no idea. Women were so good at hiding it with the pills, and I didn't know the pills existed. So I guess the point I'm trying to make is that women also have to become aware of the fact that it happens, and they have to be able to communicate with a man without shaming and backlashing. But again, I understand where the woman comes from. It might be this kind of like might be a bit selfish of a woman to do so. But at the same time, don't you think that men can be also selfish of sort of constantly thinking about how they're performing and how they don't care about sex almost? It's like they're just thinking about how am I going to perform? How am I going to...
It's a vicious cycle, because we want to make sure that we're able to please our partner, but in a way, even if we can make them orgasm, or we can make them sure they're having a good time, it's doing it for them, but also doing it for us, so that we feel good about ourselves, that we've done something.
It's about ego, right?
Yeah,
it feels like it's just about the ego, and quite
also,
often,
if the man is feeling paranoid with these thoughts, they're spiraling out of control, that if I can't perform, if I can't satisfy my partner in the bedroom, I'll just go and perform elsewhere because I need to feel like I'm a man's man. And I also need to massage my ego.
Yeah. It's okay, like I said, it's ingrained in who we are. Like we want to, and it's tied into what you were saying earlier about provision and being this provider. It's all linked. Being able to provide children, just being able to provide sex, but we also be able to provide for the family and to have money. So all these things are linked together. If we're not able to have sex, or maybe you haven't got the best paying job, we're feeling more, maybe the woman is more dominant or she's not satisfied, then it can severely affect who we are. You know, we can't even stand up tall. You mentioned the other day that actually, as girls, you talk to other girls about, you know, what's happening in the bedroom. That is like our worst nightmare. So imagine walking
Don't men
into
do the
it.
same? No?
Not really.
No.
We don't really talk about this stuff. And if it is, it's very, very surface level. You know, we don't really get deep. And this is what I'm trying to do, is encourage these deep conversations, and why we're here today having this conversation. It's so important.
It's okay. It's okay to talk about these things, you know, and actually if you communicate and you talk about these things, then that's half the problem fixed.
Yeah.
I agree. Yeah. Awareness is the key.
In terms then of a man, his neediness, Dr. Childs, you know, a man needs to feel loved. And if a man has sex, then he feels loved. But for a woman, she's not going to have sex unless she feels loved. So there's this kind of contradiction between the two. So surely this man's neediness to have sex is going to have a huge impact on him if he is suffering with ED. You know, he's not going to feel loved anymore. If he can't have the sex, then he hasn't got this feeling of love. There's a big problem. Whereas for a woman, if she's not gonna perform in the bedroom until she feels that emotional connection with a man.
I don't know. I think it does definitely flow both ways. I think there are women that can have sex without necessarily having that emotional connection. But men can have sex without the need for love. I feel like it's a bit more of a primal instinct for men just to want to have that. Some men might need a bit more connection, especially when you're in longer term relationships. It isn't just about that physical connection. But in order to feel love, I think there's so many different things that come into play, especially when you look at things like love languages, for example. But I do think that men can just have sex, and not necessarily. That's why I feel like men can go away and cheat, and not worry about it.
I also believe that men should sort of be able to speak out a lot more, maybe not hold so much in. But of course, I understand that it's mainly the job of a woman to make him feel safe and welcome to sort of speak out.
But does this not explain the man's neediness to have sex in a relationship? You know, his neediness to feel loved, and that's why he wants to have sex.
One thing that I want to, it's so important that you guys are doing with this whole philosophy of your center and with this recording you're doing now, is breaking down what's been talked about already. If you think about it, there are some things, if you have a problem, you tell everybody. You know, you break your arm and you put a picture of it online and people sign your cast. But there are two areas where people hide it. One is psychological disease. If you have major depression, you may not share it. Or if your spouse or loved one has schizophrenia, there's this, you want to hide that. And you're not going to go post that on social media. And the same thing with sexual dysfunction. For it to even count as sexual dysfunction in women, the woman has to be suffering emotional distress from the problem, whether it's pain or trouble having an orgasm. And even with that very strict definition, around 40% of women have psychological distress from their sexuality, but still only, the last research I saw, only 14% of them ever talk to their doctor about it because they're embarrassed and they think there's no help for them. And the same way with men, not only with the reason online Viagra sells like crazy in the US is that men are embarrassed to even tell their doctor that they have a problem. You'll never see some big celebrity, like one of the things I came up with was the vampire facelift, and celebrities do it and they have the picture, but you'll never see a celebrity endorsing a sexual dysfunction thing, because even though they're people and have problems too, they're never going to come out and say, yeah, I had this problem, or very rarely are they going to be bragging about that, because as a society, even women attack other women. They'll, with cruel remarks, if you go online and see the remarks they have to each other, and men to other men, there seems to be less sympathy for people who have sexual dysfunction and less even among partners and among those wider social circle, um, and so it's really tragic, and it's a big function of what you're doing right now, as you said, bringing it out to where people can talk about it. And of course, it's critical to, if you look at the research, even highly successful women like you guys, their research shows that they still look for a partner who has at least on their level or higher social, economically, because there's just this need for people to have excitement and safety at the same time, and that carries over to a man wanting to be powerful, and part of that is to be sexually potent. So it's such a mixture, and the big part of it is just getting it out in the open and letting people know we have a way to help it, and that needs to be talked about.
Yeah, to break down those barriers and to open up the lines of communication between, you know, men and women and women and men and women as well. So yeah, that is the aim of today. Lastly then, Dr. Charles, is there, have you seen a trend of older patients that are seeking the PEOT? You know, quite often you see the 70-year-old rock star with the 25-year-old supermodel. Has there been a PEOT involved there because of this man's neediness to feel loved later in life, you know, into his 70s, into his 80s? And quite often you see the scenario of, you know, the older guy with the hot supermodel. Has there a PEOT been involved there, or is it, you know, is that man able to do the deed?
Well, maybe not, but I have also been a medical director of nursing homes for the elderly here, and sex goes on in the nursing home.
Wow.
There never quits being. I can think of one instance where a couple was caught, and if you're the man in the nursing home, you're pretty popular because the men
Of
die off
course.
before the women. But yeah, there never quits being a need to have intimacy, physical, whatever that can be, and it just gets modified as we age, and thankfully now we have new technologies. So yes, there's a demand for people because we're living longer, and we have these new technologies to maintain both mental, physical, and sexual function into our elderly years. And thankfully, there really truly is a new sex revolution involving women, where women are saying, yeah, I want to be fixed too. We have all these things for men. Why shouldn't there be something for me as well? And up until maybe 6 years ago, there was not one FDA approved drug for women to help them with their sex. And now we still only have 2 or 3. So that they're catching up with the technology, but um, there's this true social and medical revolution going on that you guys are a part of, and you're leading because you have the best of care, the best minds. Obviously, you have 2 of them there, and you have, you know, leadership from your founder, who's just an amazing physician. I've met him, and he's an amazing leader, and you have implementation of the best technologies as part of this revolution of people demanding that they are able to maintain functionality until the end.
So the future is bright for all of us.
It truly is, yeah.
Okay, thank you, Dr. Charles, for your time. It's been a really interesting discussion. The inventor of the P-shot, the O-shot, the vampire facelift, and the vampire breast lift. Thank you very much for your time.
It was an honor to be here. You guys obviously you have a leader who's top doctor on the planet, and you're creating the best minds there in your center to take care of people. So I'm very, very honored to be. Yes, there he is. So thank you very much for putting great minds together and for letting me have the privilege to have a conversation with you guys. Thank you.
Our pleasure. Thank you very much.
Thank you.
Nice meeting you.
If you believe in equality, our vision is to give people longer life, better health, and better look. We said, look better, feel Yugen.
Let me introduce to you Dr. Aller, a urologist and sexologist here at Yugen Care Clinic. He's going to talk more about ED and the treatments that are offered, the PEOT treatments that are offered at the Yugen Care Clinic. Dr. Aller, can you explain why do patients come to you for the PEOT, and what is your approach when a patient arrives with sexual dysfunction?
Hello, Selena. Actually, patients come to us not only because they lack erection, but also because they want to enhance their erection and to have like a better erection. Here in Yugen Care, we use the 360 inside and out approach, which allow us to have a better understanding about the underlying causes and gives us a wide image of the underlying causes that affects ED. So here we treat every patient like a special unit.
So it's a personal approach.
Yeah, it's individual approach related to every patient situation. We have here, like I told you, tests and methods to analyze every patient situation and to act accordingly.
Okay, so if a patient comes to you and says, I'm really suffering with erectile dysfunction, but I find it really difficult to talk about, how do you get that patient to open up? How do you get that patient to openly discuss the issues that they may have previously had?
Yeah, I think the relation between the patient and the doctor is based on honesty,
Yes.
So if the patient hide any detail, that will affect him first of all, not the doctor. So we try to have the patient to speak frankly about their issues, about their problems. And we will, during this questionnaire, we will have some points to be based on our treatments. So if we have a young patient, we think that younger patients are able to or prone to have stress-related erectile dysfunction. So we concentrate on the mental status of them. While if we have 70 or 60-year-old patient, we concentrate more about organic causes because they age, and age itself is a very important reason of erectile dysfunction.
Okay, interesting. Erectile dysfunction affects mainly men over the age of 50. Can you describe your typical patient that comes here to the clinic?
Yes, actually, there is no age bracket for our patient. I have a 29-year-old patient. I also have 69-year-old patient. So I think erectile dysfunction affects every man, But there is the reason that we are here concentrating about, So I told you we use the 360 inside-out approach. And I am proud to say that here in Yugen Care, we have the new brand and most advanced methods and techniques to analyze the patient and to know the causes that affects his erection. Okay. These tests give you examples for them, like the Dutch Plus, which is a deep analysis for the hormones that affects and controls emotions and interactions. We also have the neural check test, which is a stress analyzer scan that shows the relation between our hearts and the brains and how they affect the general health. So we take the patient and we try to make more questions to know, is this patient have organic erectile dysfunction or psychogenic erectile dysfunction or both?
Okay.
And during this we will do other tests and other therapies to increase the efficacy of the PEOT and to make the patient have the maximum effect of that.
So sometimes these treatments can run alongside each other. You're not going to jump straight in with the PEOT.
They go spontaneously. So PEOT takes, let's say, from days to weeks to have the maximum effect. So during this, the patient will have other tests to know the underlying causes. Maybe he has hormonal issues. Maybe he has other vascular issues because erection is a multisystemic action. Hormone has part of it, endovascular, nervous system, muscular system, all have part of erection. So maybe one of these is the problem. So during our treatment, we are spontaneously giving the shot and then trying to fix the underlying causes, because when the PEOT will have its effect, the body will be healthy and will be more able to have the efficacy of this shot.
So would you recommend the PEOT then for someone, for a healthy man that wants to maintain his healthiness? He wants to, like a man will go to the gym, or that we eat healthily, we want to look after ourselves. Is this all part of that kind of approach where a man has to maintain the level that he's at?
Yeah.
You would recommend the PEOT?
Why not? Yeah, why not? It's all natural, no side effects, no reactions, no allergy. It's like autologous material from your own blood to a part of your body. So why not having PEOT like every 3 months, every year?
Okay.
That depends. Every patient has a special metabolism and has a special body structure. So why not having it every year, every 3 months, every 6 months?
Okay, that's interesting. Dr. Allah, thank you very much for your time.
Thank you, Celine.
With this pre-season episode, we are launching Yugen Hour, our new cutting-edge talk show on beauty, well-being, and longevity. You can expect bold experiments, controversial discussion topics, and exclusive guests. 7 more episodes will be coming in season 1. We are going to explore and expose the latest research, the controversy, and different vantage points to topics like biohacking, embarrassing bodies, health insurance, and the exciting future of health and beauty. Stay tuned for episode 1 and give it a thought. Do you want to live forever, or would you prefer to die relatively young?